Welcome everyone! I am Nicole Andre Luzon, a Mad Science student of the University of Mindanao. This video lecture is about alternative medicine, one of the special topics in modern science. As we know, it is any product or practice that is not part of standard care administered by medical professionals, but aims to achieve the healing effects of medicine. Alternative medicines usually lack sufficient evidence of effectiveness, but it has been subject to a growing number of studies lately, and some of them are being accepted and recognized by the traditional medical world. There are many types of alternative medicine, and in this video, we will talk about energy medicines. Here's the topic outline of today's discussion. What is energy medicine? The different types of energy medicines, which are acupuncture, magnets, therapeutic touch, Reiki, Qigong, and Tai Chi, and we'll wrap up with the summary. Let's go! Firstly, energy medicine believes in subtle energy fields they call biofield, which exist in and around the body and affect health. A universal life force called Qi is the central underlying principle in energy medicines as well as all other traditional Chinese medicine, of which acupuncture, or first energy medicine, is a part of. This is one of the most widely accepted and complementary therapies in the Western world. This is done, as you can see in the picture, by inserting thin needles into the skin and underlying tissues. Stimulating the specific points is believed to affect the flow of Qi along energy pathways or meridians, and thus restore balance. The procedure is generally not painful, but may cause a tingling sensation. The World Health Organization has issued a list of conditions where evidence of efficacy is either strong or available, but still needs further study, including symptoms of cancer therapy, depression, dysmenorrhea, pain, headache, hypertension, post-operative symptoms, some complications of pregnancy, and stroke complications. Although treatments are generally safe, adverse effects of acupuncture are probably underreported, which includes the following: retained needles 31%, dizziness 30%, loss of consciousness or unresponsiveness 19%, falls 4%, bruising or soreness at the needle site 2%, pneumothorax, which is a collapsed lung and happens when air leaks into the space between your lung and chest wall, 1%, and other adverse effects at 12%. Next up, use of magnets in energy medicine is also called magnetic field therapy and bioenergy therapy, and utilizes static magnetic fields, which are constant fields produced by permanent magnets, or pulsed electromagnetic fields, which are intermittent magnetic fields produced by an electromagnet. It is a popular treatment for musculoskeletal disorders, which are injuries or disorders of the muscles, nerves, tendons, joints, cartilage, and spinal discs, and neuropathic pain caused by the damage of the nervous system, and symptoms may include excruciating pain, pins and needles, difficulty correctly sensing temperatures, and numbness. We have next therapeutic touch. The philosophy behind this treatment is to use the therapist's biofield to influence the patient's own biofield. The name of the therapy is quite ironic, as practitioners do not physically touch the patient. Instead, as you can see in the video clip, they move their hands at a distance over the patient. The therapeutic touch has been used to lessen anxiety and improve the sense of well-being in patients with cancer. However, a systematic review of the existing studies did not find sufficient evidence to support therapeutic touch's effectiveness for treating any disorder. Reiki, which originated in Japan, is a type of energy medicine. In Reiki, practitioners intend to channel energy through their hands and transfer it to the patient's body to promote healing. Reiki's techniques are somehow similar to therapeutic touch. However, the main difference is that Reiki gives light, non-invasive touch with the practitioner's hands placed and held in a series of locations on the head and front and back of the torso. high-quality clinical trials of Reiki are limited, and evidence is mixed. Some reviews suggest beneficial results in the treatment of pain and anxiety, while others have not shown a benefit in depression or other clinical conditions. Here is a side-by-side comparison of the therapeutic touch and Reiki. We can see that in practice, therapeutic touch is administered by experienced practitioners, whereas in Reiki, it is passed on to lineage of Reiki masters. Therapeutic touch intends to direct the flow of Qi, while Reiki allows the flow. Therapeutic touch is generally hands-off with an assessment after the session, while Reiki uses hands-on, light touches and non-invasive techniques with no assessment after the treatment. Both of these energy medicines aim to achieve relaxation, decreased anxiety, well-being, and healing. Lastly, Qigong and Tai Chi are components of traditional Chinese medicine, using gentle postures, mindful movement, and the breath to bring the patient's energy into better balance. Generally, these energy medicines can improve balance, stability, and flexibility in older people, including those with Parkinson's disease, and show potential to enhance cognitive functions in older adults. Here is a side-by-side comparison of how Qigong and Tai Chi moves are done. To sum it up, here are the salient points for each of the energy medicines presented. Acupuncture uses thin needles, proved to help in several conditions, has contradictions, but is generally safe. Magnets uses magnets of different kinds and sizes, and data on effectiveness are mixed. Therapeutic touch, where practitioners move their hands at a distance over the patient, and no sufficient evidence is present to support its effectiveness. Reiki is a non-invasive touch with the practitioner's hands, some beneficial results in the treatment of pain and anxiety. And lastly, we have Qigong and Tai Chi, which uses gentle postures, mindful movement, and the breath, and may boost brain function and reasoning ability in older people. Is alternative medicine, specifically energy medicines, effective? Will you venture into these types of practices? Well, it's up to you to decide. But it is important to understand more about these things so you can keep yourself safe and healthy. Let us put Hippocrates' words in mind. Wherever the art of medicine is loved, there is also a love of humanity. That's all for this video. Here are the references of the lecture. Thank you all for watching and stay safe. Goodbye!